following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
I tend to sort of want to hibernate, not go out and see friends. So symptoms like that are really pretty profound for me.
This local woman suffers from seasonal affective disorder, and she is not alone. Welcome to Rex on Call Live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. We begin our show today by expressing our deepest sympathies to the families of the victims in the Sandy Hook shooting. Our show has been planned to talk about seasonal affective disorder, a type of depression caused by the decreased amount of light in these winter months. And our experts will be here to answer questions on that topic. But we also want to make these mental health professionals available to answer any questions or concerns you may have on mental health care in this area in light of Friday's events. If you're watching us live now and you have questions concerning seasonal affective disorder or other areas of mental health, just call the number on your screen. Your questions may be answered here live in our program by our experts. Those experts answering your questions are Dr. Bradley Gaines with the Department of Psychiatry at UNC School of Medicine, and Dr. Brian Scheitman, the Medical Director of the Wakebrook Campus Mental Health Facility. To call us here, just dial one of those numbers on your screen. You see it there, 919-744-3876. Outside of Wake County, call toll-free, 877-277-6252. And if you're watching us as we're streaming live on WRAL.com, you can email us your questions at rexoncall@rexhealth.com. You can even find us on Twitter. Send us a message at Rex Healthcare, #RexOnCall. Now, as you're making your way to their phones, here's the story of Lorena Uribe. For years, she thought she just had the holiday blues, but her symptoms interfered with her daily life.
For Lorena Uribe, it starts in late September every year.
I notice weight gain, I notice a great deal of lethargy and sluggishness. I tend to sort of want to hibernate, not go out and see friends. I have a difficulty concentrating. So symptoms like that are really pretty profound for me.
She suffers from seasonal affective disorder, a type of depression that occurs in the winter months when the days are shorter. Her symptoms are some of the most common, but there are others like anxiety, hopelessness, loss of interest in activities you once enjoyed, and difficulty concentrating. Seasonal affective disorder, or SAD, is more than just the winter blues. Lorena got professional help, and she now takes medication and active steps to keep the symptoms of SAD from taking over.
It takes a concerted effort in every area of life.
She takes long walks, sits in the sun as often as she can, and she's found nutrition and exercise make a huge difference. She goes to a wellness center.
Rex Wellness Center in Cary. They have a most wonderful therapeutic pool. And so I go there during the winter and it uplifts my mood. It's just been a tremendous experience. It gets my arms and legs moving and it puts me in a very elevated mood.
And by February, Lorena notices she feels better.
A lot better, and especially down here in North Carolina where the weather is just so cooperative. It's been very easy to get out of the mood.
And we're already getting a lot of calls, and we have an email question that came in from Kay. This is on the topic of seasonal affective disorder. How is SAD diagnosed and treated conclusively? Dr. Gaines?
Seasonal affective disorder is really seen as a particular type of major depressive disorder, and it's one which is kind of a specific subtype. So it's one in which it's pretty clear that there is a time orientation, so that the onset is in the fall or winter when the days are getting shorter, and then actually many times it'll remit almost completely in the spring when days start to get longer. So in addition to kind of meeting a major depressive episode definition, there would also be that timeliness part, that timing when it goes on and off. And then also, people need to have that happen for at least 2 years with a persistent number of depressive episodes they have that time.
Okay. Now, are men or women more likely to suffer from this?
In general, women are more likely to be diagnosed with a major depressive disorder, and the same is true with seasonal affective disorder. So it affects both.
Okay, let's talk about behavioral health resources out there for people in this community, and talk to us about what you're doing.
Well, Wakebrook campus is going to be expanding. UNC has committed about $40 million over the next few years to improve mental health services in Wake County. So we will be opening up a 16-bed inpatient unit on the Wakebrook campus. We are going to increase the capabilities of the substance abuse treatment to allow a more complex patient to be treated there. And we will continue the crisis and assessment services that are currently in place. So we're really excited about the Wakebrook campus, and UNC is also working with the Alliance Managed Care Organization and Wake County Human Services to work together to figure out the optimum way to provide mental health care in Wake County.
And I think it's a question on everybody's mind, especially in the wake of what happened on Friday. As a family member or an observer, if you know somebody, you love somebody that you think perhaps needs some help, what do we do?
Well, it's kind of sad that the majority, some studies have looked at the majority of the people with mental illness, and most of them don't actually get any treatment. And that's kind of sad because a lot of these disorders can be effectively treated. So there's many ways to access services. Feel free, if you call on this show, I think we will direct you to the service. It depends a lot where you live and what the resources are, to be frank. But there is help for everybody if they try to access those services that we would help you to hook up with.
And we were talking, there's been talk that this gunman in this situation had Asperger's, but Asperger's is not necessarily something that makes you violent. There was more to this.
Yes, that's true. I mean, just as there are violent episodes in folks who don't have mental illness, or maybe folks who maybe have substance abuse, that doesn't mean that everyone who has substance abuse is violent. Right. Similarly, everyone who may have Asperger's or an autism spectrum disorder, by no means does that mean that they're violent or more violent than others. And really, in general, the same thing goes for some of the more serious mental illnesses, like psychotic disorders, like schizophrenia or bipolar disorder. There may be a slightly increased risk of some violence, but it's still such a small number, such a rare occurrence. It's a hard thing to predict and identify. Okay, and again, we had planned this show on mental health and seasonal affective disorder, and so it's very, very timely that we have you gentlemen here. Let's back to seasonal affective disorder. Are you more likely to have this if you do suffer from depression? I mean, is your depression worse through through these winter months? So folks with seasonal affective disorder, it may just happen in the winter months, or it may actually happen at other times of the year. If you have a major depressive disorder at other times of the year, there is some slightly increased risk of also having seasonal affective disorder. And if you look at some of the latest numbers, probably about 5% of the U.S. population would meet at least diagnostic criteria for seasonal affective disorder.
Okay, and what does that mean? That they should be taking medication, or they should be in some sort of therapy?
Well, a lot kind of depends on how significant the distress is. There are lots of ways to treat it. Like the person who began the program described, there are lots of exercises and nutrition approaches that can be quite helpful. People might use bright light therapy, phototherapy during the winter months, which can also effectively treat seasonal affective disorder. And for those who have a recurrent problem where it's quite severe and it comes back every year, there actually is there's a medication that can be prescribed that's FDA approved to prevent the onset of seasonal affective disorder. So there can be some of a preventative approach too.
Okay, thank you very much. Phones are ringing, and we're taking in those questions, and we're going to be back after the break to answer some of the questions. You can go to WRAL.com, search Rex on Call. Now, there are steps you can take to treat seasonal affective disorder. It's called the Sundin Protocol for seasonal depression, and here to explain is Mark Jakes, the Executive Director of Mental Health Advocacy, Inc., and the Director of Consumer Affairs for NAMI, the National Alliance on Mental Illness in Wake County.
The Sundin Protocol starts with the sun.
The best way is to get exposure to the sun by taking a walk outside 15-20 minutes a day, or you can use a sun equivalent and get a light box, which is artificial light.
Next, D as in vitamin D.
The D, of course, in Sundin is vitamin D, and that's a very important vitamin for your body to produce endorphins. Endorphins are the brain chemicals that help you feel better.
Talk to your doctor about taking a vitamin D supplement to make sure you're getting enough. Next, E for exercise.
When you're depressed, exercise is one of the hardest things to motivate to, but it really helps in a lot of different body chemistry.
Now N for nutrition.
If you're just healthier, you can often offset some of the seasonal affective problems that people get every year.
And E stands for everything else that makes you feel good, like a good joke.
Humor is very important in creating endorphins, brain chemistry that creates endorphins. When you laugh, you feel better.
Okay, we have a lot of questions to get to. A lot of these questions are about access to mental health services. Somebody thinks they have a problem. Where should they start?
Well, the mental health system is undergoing a little bit of a transformation and I'll talk about Wake County, and from Wake County Human Services to Alliance Behavioral Health. But I think a good place would be to start to call Wake County Human Services. If you run into any roadblocks, Alliance Behavioral Healthcare is the managed care organization, but that would be a good place to start, and then they could direct you to some services if that's not the right number. If you live in different areas, you may be directed to different places, but that would be a good place to start. So Wake County Human Services.
Okay, and if you call the show today, we'll make sure we get you in touch with the right people. This is from Mary. Her dad, who's 87, has a seasonal affective disorder for many years. He had a brain bleed, so he cannot take many medications. Do the lamps that they advertise give off the types? Would that lessen the disorder?
In terms of the seasonal affective disorder part, yes. I actually think that phototherapy in that case may be a superb choice given some of the complications from his bleed.
Okay, is Prozac a good medication for seasonal affective disorder, or is Prozac or a light box? Is there a better option? Is one better than the other?
So a couple answers to that. Prozac is a reasonable medication to treat. Most of the antidepressants we would expect to work the same way. So really there's no kind of best antidepressant necessarily to use, although there are some antidepressants that can prevent seasonal affective disorder a little bit better. In terms of whether antidepressants or the light box is better, the comparative evidence there, it's kind of mixed, but it really looks like both work about the same, so I think either is a pretty good option. The key is have it identified, start it, and make sure you're getting the right treatment.
Okay, this is from Anna in Raleigh. Her sister is to the point where she's afraid to come out in public, and she thinks people are watching her. She lives alone, and she still drives, so her sister's obviously very worried about her. Which steps, as a family member, should she be taking?
I think unfortunately, that's not that uncommon a situation. If there is a good relationship, if maybe the sister could help the person go to an appointment with a mental health professional to start the process of getting care. Sometimes people don't want to go, and sometimes it needs a little persistence and kindness and to discuss what might be the barriers, but to try to work with her and not give up and see if you can get her to an appointment. The driving is a concern too, and I think one would have to make a decision. Is there any evidence of erratic driving? And maybe she could drive with her to see how she does, so she doesn't put anybody else or herself in danger.
Okay, and this is actually another question from a mom who's worried about her adult son and trying to find a way to get him treatment. So having that conversation could be uncomfortable with a family member.
Yeah, it's not uncommon that it is uncomfortable. Sometimes I think we all sort of see things, but we don't want to maybe face it, and there is possibly something wrong, and it is uncomfortable, but it's really important to try to do it. And if it doesn't work the first time, just step back, don't get into a confrontation, and maybe reach out again to see if next time will be better.
And one brief thing to add to that is that lots of times people have kind of preconceived ideas about what mental health professionals are like. Some of the work that we do and some of the things we try to encourage is sometimes, maybe the mental health professional is not the first best person to have that interaction with. It may be the primary care doctor. People may be more comfortable talking about it initially with their family medicine doctor, their general internist, their pediatrician, and that can kind of get that discussion going that Brian was kind of referring to.
That's a
so
great
that people
idea.
can start to see that this is not something odd or weird, but something people need to understand more about.
Absolutely, that's a great suggestion. Coming up, we're going to be answering more of your questions in Wake County. Call us at 744-3876. Outside of Wake County, call us toll-free 877-277-6252. We'll be right back. Call here live on WREL. We have a whole stack of questions, so let's get to them. This is from Gloria. She has a thyroid problem, and could that be causing her depression? Because she's not on any medications for depression at this time.
Absolutely. Thyroid disease, or especially when the thyroid is underperforming, underworking, is really one of the great mimickers of depression. So if you have hypothyroid disease, it can actually look like, among other things, you actually have a major depressive episode. The best way to treat that is to actually treat the thyroid problem. When the thyroid problem gets successfully treated, most of those depressive symptoms should go away. If they haven't, then after that thyroid condition is under control, it's at that point that they might want to consider whether, in addition to that, there's a major depressive episode. Antidepressants work in that case too.
Okay, great. So this is from Daisy. She wants to know, she's on Medicaid. Are there resources for mental health to go see a mental health care provider with Medicaid?
Yes, absolutely. Medicaid covers mental health therapies, it covers medication, so absolutely.
Okay, this one, her son's a soldier and he returned from Afghanistan. He doesn't want to go out. He's very withdrawn. She wants him to seek some mental health counseling. Where should he start?
Well, I guess if he's a veteran and he feels comfortable in the VA system, maybe contacting the Veterans Administration to see if he would go there might be the best place if he's comfortable in that system.
Okay, this is from Richard in Raleigh. If someone has a long history of mental illness, should treatment be mandated? If not, should the person be in a long-term inpatient facility? I'm assuming this is, for some severe issues.
I think everyone is a little bit different. I think each case, it's hard to comment on the specifics of a case like that without knowing the situation better.
Yeah, and some illnesses, like for example, depression, can be chronic and recurrent ones, and that by no means means that people should be required to be in a inpatient or rehabilitation
for these severe psychotic episodes, is there a time when these people could be cured? Is there a cure? Is that word used?
Well, these illnesses are very treatable, but they're not curable. So no different from diabetes or hypertension or many other medical illnesses, that these you get treatment, most people get a lot better, but they're never really cured.
Okay. This call from Johnson County, her 16-year-old daughter has been diagnosed with bipolar disorder, but her main problem is the summertime as opposed to the winter months. Is that something you find?
It actually is something you find, because as spring and summer start to come on and days get longer, that actually can often lead to what people would call hypomanic or manic-like symptoms. So it actually might cause the individual more problems because it leads into the manic episode, that high part of bipolar disorder.
Right.
Whereas you would expect there probably to be most likely less problems with the depressed part during summer, probably.
Because of the light change?
Because of the light change, that's right. In fact, some people with seasonal affective disorder coming out of their kind of their winter seasonal blue can really just shoot straight up into a high. So that's something to keep an eye on. Doesn't happen that often, but something to keep an eye on.
Okay, we're going to have a final round of questions right after this break. This is Rex on Call. Welcome back. This is Rex on Call live on WREL. We're going to get to a final round of questions. This is from Betty. She had her 66-year-old brother committed. He had been in prison. Now he's out. Where can he find help? Where can she get help for him? He has no benefits, obviously.
Well, if he's 66, he might have Medicare, so that might be a resource for him. And I think it's part of, if he's in the hospital, and then the hospital could work with her to figure out a good discharge plan prior to him leaving. So she should really speak to the hospital treatment team, and they should have some plan before he's discharged.
Okay, this is a concerned mom who's a Medicaid patient. Her 19-year-old daughter has a Percocet problem, and she says she's at a breaking point. She's exhibited signs of rage and mental illness. What's her first step?
I think the first step is to try to get in to see some kind of mental health professional. Again, whether it's through a primary care initial step to help begin the discussion about whether there's a problem there or whether they might go straight to the mental health professional. But one of the complicating things about things like Percocet or other narcotics is they can also mimic a mental illness. So what you were describing, it's unclear whether that was the result of her being intoxicated or abusing the Percocet, or whether that is some other underlying psychiatric illness. So I think the key is really to have her go in and just start to talk and see what's there.
Okay. This is calls from Leah. She has seasonal affective disorder since grade school. She wants to know a little bit more about the medication, specific medications, antidepressants that could help prevent it. And she already takes vitamin D, so wants to know if there's any side effects with antidepressants and vitamin
Well, so
D.
the one FDA-approved medication to prevent it is Wellbutrin XL, which people would actually take leading up until the beginning of the seasonal period. So they would start to take it going into the fall, and then really stay on it until kind of spring came and the days got longer. That's really the one medication where there's some clear evidence that it helps prevent the onset of medication. Beyond that, the other antidepressants are quite similar. Phototherapy, also quite effective. Want to make sure you're going to get one that on average gives something like about 10,000 lux. You'll want to do it each morning for about 30 minutes.
Okay. This call is from Linda. She's actually struggling with, during the holidays, excessive hoarding and spending during this time of year to an excess. I mean, we all spend a little too much money, but to an excess. Are there treatments? Is it talk therapy? How do you work through that? Anybody want to take that one?
I mean, it's an interesting question, and it's not that rare an occurrence. That's not necessarily the kind of thing that you'd want to say, yes, there's a medication to help you with it. Again, I think the first key step is to get in, discuss it with someone, and see whether what's going along with those hoarding issues. Is there an anxiety disorder there? Is there a depressive illness? Is there something else happening?
Okay, especially if it's happening this time of year. This is from Paula in Wake Forest. Her son has been diagnosed with bipolar disorder. He's a truck driver. Where could he get counseling if he's constantly on the road? Or how does he get treatment if he's constantly on the road?
That's definitely a difficult question. Probably.
We put you on the spot here, and I'm sorry about that.
It's kind of interesting because there are medications that could help him. There's always that key balance between being on medications and making sure that that's not impairing his driving to some degree. And there are medications that people can tolerate well. You can get them to therapeutic levels, and that it's not going to cause problems with driving.
Okay.
So again, I think the first step is to begin to make that assessment.
Okay. This is a problem sleeping, and she's looking for help to find somebody that can help her through her anxiety and sleeping issues.
Well, problems with sleeping and anxiety can be multifactorial, so probably the best place to start would be an assessment from a mental health professional to get more details and to see if there's sleep hygiene issues, meaning does she use the bed to sleep or the bed for other things. And so it probably, I don't mean to be too vague, but it needs probably more of an assessment to give an easy answer.
It's hard to answer with a quick phone call. Okay. As always, consult your physicians about any health concerns, and thank you guys so much for this valuable information. I think it was really important today. And to the phone bank, they're still taking calls. Be sure to mark your calendars for our next Rex on Call. That's Monday, January 21st at 1 o'clock. The topic is A New Year, A New You, and we want to know your biggest health challenges and the most important health goal for the new year. And this promises to be interesting and inspiring. Email us your questions ahead of time, rexoncall@rexhealth.com. We're going to see you next time. Thanks for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.